Hello my dear students, today we are going to study another respiratory disorder, that is bronchiectasis. Okay, so let us understand what is this. The definition: bronchiectasis is defined as a chronic, irreversible, localized dilation of the bronchi and bronchioles. So here the main problem is with our airways. Okay, with our airway is the main problem. Now what is happening in this bronchiectasis? What is happening over here is a chronic problem. Chronic means that is not just within one day the person develops this. Longer period of time it gets to develop this problem. That is not just an acute, it's chronic for a longer period of time. Irreversible, this is a very important word. Commonly this question is asked for you, not in an LAQ or SAQ. Short answer, long answer, very rare, but commonly I've seen asked as a definition. Even if it is asked, it can be only asked as a short answer question, but never as a long answer question. So commonly asked in the definition, so let us understand definition properly. So first, it is a chronic problem. Next, very important word, irreversible. Is not reversed back to normal. Irreversible, localized. What do you understand? Localized at only one region. What is there? Dilation of the bronchi and the bronchioles. You know what are bronchioles, right? Bronchi is there, further divisions, or you see segments forming, and then bronchioles are there. So what is happening over here? Most commonly, you can see in the picture, there is dilation is there, and there is more amount of mucus secretion. And why this is happening, we'll be seeing more in the pathophysiology, but hope you understood the definition. The very important word over here is a chronic, irreversible and localized, and which area it is affecting. Which area it is affecting? The airways, that is bronchi and bronchioles. Your alveoli is not affected. Clear enough? Yes. Next is the main cause. What is the etiology? Airway obstruction, pulmonary infection and obstruction. Now obstruction of the bronchus are mostly because of more amount of secretions. As we have seen that in the picture also, you have seen there is more amount of mucus secretion inside. Now this why this mucus secretion? The only function of our body is to prevent infection to go down to the lower respiratory tract. So inflammation is there, mucus secretion increases. All this mechanism is to protect us. But when this is happening for a longer period of time to one region, what will happen? There is further obstruction of the air, right? So that's why airway obstruction is common over here. Any diffuse airway injury, any injury to the that is to our airways, that is bronchi or bronchial, then this disease can occur. Next is any genetic disorder such as cystic fibrosis. Cystic fibrosis is one of the respiratory problem, which is a genetic disorder. That is, if parents are suffering, the child can also suffer from. So it's very important that we have to see whether the person is suffering from this, then he can lead into bronchiectasis. Immunodeficiency, that is whose immunity is low, then further infection chances are more. Risk factor. Very important risk factor, cigarette smoking. We have seen in maximum respiratory condition, cigarette smoking is the commonest risk factor for all the respiratory problem. Next is recurrent infection in the early childhood, and the third one is aspiration of toxic gases. If by chance a person has aspirated any toxic gases, then also this problem can occur. Next is the pathophysiology. So what is the pathophysiology? Here the trigger is nothing but our main clinical our main etiologies and the risk factors. They cause airway inflammation. Airway inflammation means what? If these triggers which are there, let me take it smoking. When the person is smoking once, fine. Second, many times, for months and years the person is smoking, your bronchi, your bronchial wall, okay, the bronchial wall is affected. What happens over here is this continuous exposure of the triggers or the irritant causes inflammation. Okay, now let me take this as a bronchi and particularly inflamed. Otherwise it has to be in a proper structure. It gets inflamed. Now because of this inflammation, what happens? inflammation, it causing further less amount of air to pass through this narrow structure, right? Now here it is affecting to one particular region, depending upon which area it is, or where the person is smoking, or what the person is doing, depending upon the exposure and all, it will depend on that. So airway inflammation will be there. Next is ineffective pulmonary defense. Ineffective pulmonary defense, here what is exactly happening is that the pulmonary structures are not able to take care of themselves properly, and because of that further sputum hypersecretion happens. Now first is, ideally there is secretions, mucus secretion increases, then there can be hypersecretion because of the chronic exposure of the irritant or the etiological factors. Impaired mucociliary clearance. What do you mean mucociliary clearance? Means there is no adequate, the person is able to remove out that particular secretion which is present inside. Now why this increased secretion? Because what happens after the inflammation, our mucus secretions increases. Why it increases? So that the particular irritant which is there, the mucus secretion here at both the layer increases, so that the irritant just gone inside, it should not reach the lower respiratory tract, so it gets attached in that mucus particular. Okay, this is a common body's mechanism. But when this is happening for a longer period of time, okay, it's not just 1 day, 2 day, many months, years the person is doing, it is becoming totally affected, and there is hypersecretions. Okay, now this is our body mechanism. But with time, when there is no improvement in that particular etiology, or there is a continuous exposure of the trigger or the irritant, this is the problem which is happening. Okay, so I feel the body is giving signal, right, that you please stop, but the person is not, and it's further causing problem to him. And commonly you can see the person have cough, sputum production, right? We will be seeing the clinical manifestation, and that causes further damage. Especially what is getting damaged over here is our bronchi and bronchioles. The main airway are getting damaged. Okay, now here remember why it is shown as a cycle, because this happens continuously. Inflammation, increase mucus secretion, so sputum will be increasing, your mucociliary clearance is affected, there's no proper. Now if you know what is cilia, cilia is nothing but the hair-like projections. It helps in prevention of the irritant or the microorganism to, it prevents the microorganism to reach down, that is the lower respiratory tract. Now when this irritant, let me take it as a smoke, this is a cigarette and the person is smoking too much, when that is there, what happens, this ciliary function is affected. Your cilia or the goblet cells which are present, they don't function properly. Okay, goblet cell will increase more mucus, but cilia will not work in to prevent that particular irritant to go down. It will nicely go down. When the cilia are not affected, it will further go down. Okay, lower respiratory tract, and further cause problem. That's why from bronchi it is reaching to the bronchioles. Are you understanding? So this is what is the problem, and here the only thing first is to remove that particular etiology or the irritant which is present, and that's why this is shown in the cycle. Trigger comes, this happen, and this continues when it's going on, it is leading into bronchiectasis. Okay, what are the clinical manifestation you are going to see? This is very important. Chronic cough. The person is going to tell you, I'm suffering from many months, I'm having cough. Okay, and how is the cough? With purulent, copious, purulent, with pus formation sputum. Okay, you can ask him what is the color of the sputum. Okay, next is, it can be with blood tinged, we call as hemoptysis, that is blood tinged sputum. Okay, now that can be because of some damaged capillaries of our bronchi. Okay, next is clubbing of fingernails can be there. When the person is suffering for a longer period of time of respiratory disorders, where he is having, where he may be having shortness of breath, he is having maybe hypoxemia, that time the person can develop clubbing of fingernails, which your nails becomes a little bit broader and thick enough. Dyspnea, the shortness of breath can be there. Repeated episodes of pulmonary infection. When you ask him, he may say, I have such cough, cold, and sputum production. I have it, but he is not able to understand that this problem is not just with a normal problem. It is, he has to get treated for this bronchiectasis. Okay, so this is the clinical you will be seeing. Common is the clinical manifestation. Cough will be there. There will be shortness of breath can be there, and sputum production is there, right? What is this is very important diagnostic finding. You have to see that a definitive sign is offered by prolonged history of productive cough with sputum consistently. This is very important. Negative for tubercle bacilli. What you mean by this is that the patient should not be diagnosed as a pulmonary tuberculosis, because we have seen in TB also, pulmonary TB, that the person is having cough, right? He may have productive cough, that is sputum can be there. So when the person is complaining of this, first we will tell them to go for sputum culture will be done for this Mycobacterium tuberculosis, right? This tubercle bacilli will be detected. If it is coming negative for tubercle bacilli, then only we can see that this person can be a chance of this bronchiectasis. Are you understanding? So this is a very important, should never forget to write about this in diagnostic finding, that the person should be negative for pulmonary tuberculosis, that is the tubercle bacilli. Then only we can say that this person can be a patient with a bronchiectasis. Okay, so this is, never forget to write. Next is CT scan. When we do the CT scan of the chest, we can nicely see the presence and absence of bronchial dilation. When there is a bronchial dilation, that means this person is suffering with bronchiectasis. Next is the management. So how we are going to treat this person? To promote bronchial drainage to clear excessive secretion from the affected portion of the lung. So the main objective is that the secretion which is there, we have to remove it out. Okay, the secretion has to be cleared, otherwise that secretion can cause further obstruction. Okay, and this is very important. Either we prevent further infection or control. And ideally, we always try to control it. Prevention, once we get it, is very difficult. So we have to control the infection. So what all measurement or what all management we can do is, first is antibiotics. Depending upon what type of infection or depending upon what is the problem, that is the main etiology. Either it is because of smoking, then stop smoking. It's because of some pulmonary infection the person is suffering from, that has to be treated. Okay, depending upon either it's a bacterial problem, viral problem, that has to be treated. Okay, so antibiotic, this is year-round regimen of antibiotic agents may be prescribed with different types of antibiotics at interval. So you understand, it's not just for 1 week or 2 weeks or 3 weeks, a year round. Okay, for the whole year, different types of antibiotic have to be given for this patient in order to totally eradicate the problem. As we give in a pulmonary tuberculosis patient, as you know, we have studied about it, 6 months or 9 months course is there. The same way here also. It will be given for an year. Now, it's very important when the person is taking for an year of medicine, you have to see that he is adhering to it. This happens, common problem. The person feels better. With time, he will feel better. Then he feels like, I am not feeling anything. I am all good. I don't have cough. He can stop the medicine. So always guide him not to stop the medicine, complete up the course. If he is not completing up the course, he may, or his body, or the microorganism, if it becomes resistant to particular drugs, then we have to give a higher drugs to him. Okay, so very important is the adherence to the drug which is given to him. Next is posterior, commonly done. Posterior drainage means what? Giving different position. Like for example, this person is there, so we are just pop up with my diagrams. He's sleeping like this. So mostly now, like posterior drainage ka matlab hai, that is we are going to be giving different position, head tilt or then sideways, different position are given depending upon where is the secretion. If the secretion is at the lower lobe, then you can give head tilt so that it comes up to the bronchi, reaches the bronchi, and then it can be expectorated out by the person. So different positions are given depending upon secretion where it is. Next is chest physiotherapy, very important. Chest physiotherapy is very effective in removing out the secretions. Okay. Next is inhaled steroid therapy. Now corticosteroids, which can be given as a meter dose inhaler, MDI. MDI, that is meter dose inhaler form, you can give corticosteroids to the person to reduce sputum production and inflammation. As you know, corticosteroids helps in relieving the inflammation which is there in the person. Next is the bronchodilators can be given, and very important is to teach them to do deep breathing, that is diaphragmatic breathing exercises, okay, so that he can able to he can reduce the episodes of shortness of breath, and he can have adequate further he can have a good quality of life if he is following this diaphragmatic breathing every day at least for 3 times. Okay. Next is the surgical management. So here very important is that if through medical management the problem is not solved, then surgical management can be opted for the person. Segmental resection of the lobe. What you mean by this is because of this, if bronchioles are affected and there is too much dilation, then for example this is my lungs and there are lobes, so I can resect any segment. Okay, any segment of the a segment of the lobe can be resected or can be removed. Okay. Next is the last option can be if it is too much affecting the person is having too much of this clinical manifestation, shortness of breath, depending upon the problem, lung transplantation can be done for the patients. Okay. And next is our nursing care. Now here I have not brought for you the nursing management of assessment, nursing diagnosis and intervention, because very rarely this question is asked. You should at least a short answer question. You have to include all the points about bronchiectasis. So here you should remember to write the from starting what's the definition and everything what we have discussed now. In nursing care you have to just mention what are the care or list down the cares which has to be given. If needed, if you want to involve the assessment, we'll be discussing about that also. If you want to write, then you can write in assessment. What you are going to assess is assess for the clinical manifestation, assess for any history of any pulmonary infection, whether he is smoking and all, that you need to ask him, and ask for any genetic disorders which is present, any family history which is there. All these things will come in the assessment, and very important is the sputum which is coming out. From how long he is suffering with cough, what is the color of the sputum, that you need to ask in the assessment. And diagnosis can be ineffective airway clearance can be there related to this excessive mucus production, or it can be ineffective breathing pattern also can be there in the person. So this all diagnosis if you want you can mention. So let us list down what all thing we have to see. First is assess the respiratory status and sputum for consistency. So here you need to see how is the sputum which is coming out, what color it is, and how many times. Like for example, some people have only morning there are too much sputum which is coming out, and the whole day no problem. So you need to ask him that how much time the person is having this productive sputum which is there. Next is teach. This is very important. If the person doesn't stop the trigger or the main etiology, then this problem is never solved. So if you see, remember in the pathophysiology, there was a trigger which is written, that's the main etiology which is there. If I remove or treat this etiology, treating in the form of, if there is a pulmonary infection, I give antibiotic, and the smoking, that remove that cause, the problem is almost solved. But it's not that within one day he is going to be alright, no, because he has caused so much problem for many years to the bronchi and the bronchioles, the airway. The treatment is not just in one day, it will take time. Okay, so here we need to explain them that he has to stop smoking, that is cessation, totally stoppage of smoking has to be done. So what all thing you can guide them is there are many there are many tablets which are available to help them get rid of smoking, or they can ask help from people to help them to remove them out from this smoking habits. Okay, teach the patient about the early sign. This is very important. If any signs and symptoms of respiratory infection is there, not to ignore them but treat it as early as first identify and treat it, because if they are not treating respiratory problem, it can further cause bronchiectasis. Chest physiotherapy and postural drainage, we can help to drain the secretion out. Okay, along with that, if the physician has order, you can give nebulization to them, teach them diaphragmatic and diaphragmatic breathing exercises. Okay, administer bronchodilators and antibiotics as prescribed. Advise patient to take. This is why the person has to take small frequent meals if he is having, while eating, he is having problem of shortness of breath. Okay, then tell them to have small frequent meals. What do you mean small frequent meals? Ideally we have breakfast, lunch and dinner, and some people also have snacks and dinner. That are 4 times, right? So here you can guide them to have small frequent meals. Ideally he has breakfast, and within 2 to 3 hours he has some brunch and then lunch, on that too very small amount, so that if he is having shortness of breath, that can be reduced with a smaller amount of food if he is taking. Maintain, this is very important, adequate hydration. Why? Because when you take adequate amount of fluid, the secretion can be thinned. Okay, and it then is very easy for the person to remove it out. Okay, so you remember one thing, never give more amount of fluid to a cardiac and renal patient. Please see what is the main problem. What I mean by this is that you need to see that whether the person is suffering with any comorbidity, that is any renal or any cardiac problem. So don't increase the fluid for them. But if the person is not having any comorbidity, then please give them or advise them to have adequate fluid. Okay, at least 2 to 3 liters of fluid per day. In patient, by giving oral fluid and if possible IV fluids unless contraindicated. If the person there's no IV fluid given to them, then at least tell them to have orally at least 2 to 3 liters of fluid, so that the secretions can be thinned off. Okay, this is about the nursing care. Next is very important, is the prevention. How can we prevent this problem? Is very important that the respiratory infection which is there can be prevented by taking vaccines. Okay, so yeah, first is smoking cessation is very important, that the people should stop smoking so that he doesn't or they don't develop this respiratory problem. There are many respiratory problems which are leading because of smoking. Okay, so smoking cessation is the ultimate thing. And the second thing is that if the person is suffering with recurrent infection, then he should be vaccinated. Okay, vaccination for influenza or pneumococcal pneumonia has to be taken so that he doesn't have further recurrent respiratory infection, because recurrent respiratory infection can lead into bronchiectasis. Hopes you understood what is bronchiectasis. Thank you.